Now, coming to the atypical antipsychotic drugs, first of all, this is the best drug. This is the best drug. Why it is best drug? Just because it have the very less side effect, or you can say the no side effects. Okay, the weight gain, just remember one thing, that the weight gain is the only one drawback related with these typical antipsychotic drugs. Other than that, all the side effects which is basically caused by the typical antipsychotic drugs here all are absent. So this is the best. Now, the another thing is that these atypical antipsychotic drugs, they will bind transiently. Remember the word transiently means in a very low affinity. Okay, low affinity with very good. Low affinity with the D2 receptor. D2 receptor, dopamine 2 receptors. No problem, but their major binding site is something different. Their major binding site is with the serotonergic neurons. Okay, and that is called as, serotonin is written chemically as 5-hydroxytryptamine, also called as the serotonin. So basically the atypical antipsychotic drugs, it's bind over the 5-hydroxytryptamine or serotonin receptor, and thereby it not manage only the positive symptoms, it also well to manage the negative symptoms of schizophrenia. Okay, so this is the one benefit about the 5-hydroxytryptamine serotonin blockers, is that they also manage the positive symptom as well as the negative symptoms. Okay, now once we understand about the typical and atypical antipsychotic drugs and their side effects, okay, and their efficacy, affinity with the different you can say the receptor. Now let's move ahead and discuss the classification. So for classification purpose, the atypical antipsychotic drugs, they are different types. Okay, they are different types. The one is called as the clonazepam. Okay, this drug is actually reserved. Okay, this drug is reserved for the resistant schizophrenic condition. Okay, this is a highly potent drug. This is basically fixed. Okay, for the resistant schizophrenia, for the resistant schizophrenia. Got it? Now, then we have the another class of drug called as the risperidone. Then we have the olanzapine, QT-pine. This QT-pine is actually a short-acting drug, so it is also used as an anti-anxiety drugs. Okay, twice in a day. Okay, twice in a day, QT-pine. Then there is the aripiprazole. Okay, and ziprasidone. This ziprasidone is the latest discovered antipsychotic drug. Okay, basically a atypical antipsychotic drugs. Now coming to the typical antipsychotic drugs. Typical antipsychotic drugs are classified into the three categories. The first category is called as the phenothiazines. Okay, under this category you have the initially discovered the first antipsychotic, typical antipsychotic drug, that is called as the chlorpromazine. Then you have the another class of, you can say, drugs which comes under the phenothiazine, is called as the trifluoropronazine. These two comes under the phenothiazine. Then we have the butyrophenols. Under this butyrophenols you have the haloperidol. Okay, this haloperidol is actually a potent typical antipsychotic drugs. Okay, so their use is in the case of acute schizophrenic condition. Which condition? Yeah, acute schizophrenia. Okay, they are also available in the form of depot, in the form of IV. Then you have the thioxanthine. Under this drug you have the flupentazil. So remember the classification. This is very important for the exam point of view, and basically these drugs are available in the tablet form, okay, and IV form too. No problem. Each drug have their selectivity, okay, in the management of the symptoms, and they have their potency, drug potency. Now, if talking about the drug interaction of the antipsychotic drug interaction, then you should remember that these all drugs is basically what? They all are the CNS depressants. CNS depressants. So if patient is taking the alcohol, okay, or if patient have another, you can say certain drugs like you can say the barbiturates, okay, or you can say the benzodiazepines. So these drugs will basically potentiate the effect of the drug. Okay, there's a additive, you can say action. There's a additive action of this drug. Okay, basically if you take alcohol with this drug, it will potentiate the drug, because alcohol is also a central nervous system depressant, and these drugs are also central nervous system depressant. So it is one of the drug interaction. Then if you're talking about the pharmacokinetics of this drug, then there is you can say the oral absorption rate is not defined, but it will goes to the liver, okay, and crosses the blood-brain barrier, because it have to reach the central nervous system. So the bioavailability through the oral route is less as compared to the IV. This is about the bioavailability of this drug. Fine. So by this we finished with the antipsychotic drug category. Now we have another class like the mood stabilizers, basically the benzodiazepines, which we will discuss in our next class. So I hope you understood today's lecture. So thank you for having me. Bye. Have a nice day.